Hi, how are you doing today? My name is Sebastian Osler, and I'm going to be your student physical therapist that's working with you today. My school is Bowling Green State University. So what we're going to be doing today is I'm just going to be explaining to you some things about your diagnosis and what's been happening with you and why it happened. So the first thing I wanted to touch up on was that you had a ACL reconstruction surgery. So an ACL is just a ligament that's in your knee. We have a whole bunch of them that are in the knee, and basically they're like these long cords that just help resist certain movements so that our knee doesn't just fall apart. So the ligament that you tore was your ACL. It's very common with sports injuries like yours, where a twist or a sharp cutting movement will lead to a pop, and then your knee will start to blow up like a balloon. And it's very common, and a lot of athletes are able to fully recover from this. So I don't want you to feel stressed out about that, because we're going to be able to get you a place that you're going to be able to return to sport eventually. So right now you're still in the early stages of that recovery process, especially since you just had surgery 2 weeks ago. So the biggest thing that I want you to do is to what we call RICE. It's rest, ice, compress, and then elevate that leg. So with the rest, self-explanatory. I don't want you to be putting any weight on it. As your doctor said, you're in a non-weight bearing or a toe touch weight bearing step in your recovery, so I don't want you to put any weight on it, but we will eventually get to a spot where we're going to be putting some more weight on it further on in the physical therapy intervention. So the second one, ice, I want you to be icing for about 15 to 20 minutes. I would ice for 20 minutes on, and then, take a little bit of time and just keep that leg rested. Compress means I want you to wrap it up in some type of gauze bandages, or maybe some type of compressive wear that'll really just keep that knee in a nice compressed state. But your brace should also be helping with that, and you should have something that keeps your knee compressed while you're wearing your brace also. And then elevate, whenever you have your brace off and you're just resting at home, I want you to keep that leg elevated above your heart level, because that'll help bring blood flow to that knee, okay? And that'll also help with your recovery too. So the typical process of an ACL reconstruction in recovery would be, we're going to be putting you through physical therapy for about 12 weeks just to kind of help gain back some of that mobilization, help you start walking again, help you return to daily activities. And then eventually throughout the process, we're going to be getting back to that return of sport activities also. But in the early stages of it, it's going to take a lot of time. It's not going to completely prevent you from playing sports again or playing soccer again in your case, but it is a long process. So it's not like you're going to be back in a couple of weeks. It's going to be a couple of months. So typical time of recovery to return to sport could be anywhere from 6 months to a year. It really just depends on how your knee recovers from this injury and the type of physical therapy that we put you through. But within that 12-week span of physical therapy that I'm going to be putting you through, you should be able to return to full daily activities that you're doing, such as walking, and start progressively getting into that return to sport, okay? So the next thing I want to touch up on is the treatment plan that we're going to be putting you through. So the typical treatment plan that we're going to be doing is we're going to be focusing on trying to get some of that range of motion back in your extension, so when your leg is fully stretched out, and then we're also going to be trying to get your range of motion back in that flexion. So whenever your knee comes and whenever your leg is going up to, as in it's hitting your butt. So with this, we're going to be doing some mobilizations. We're going to be first mobilizing that patellofemoral joint. So it's just their patella that's on your knee. We're just going to be start mobilizing that. After that, we're going to move into some strengthening exercises and some neuro re-education interventions. So that will basically just be really strengthening up those muscles around that knee joint and basically relearning how to walk with it. And after this, we can then start to progress into some maybe further return to sport activities, or maybe get you start to running again and getting that leg functioning as is normal. If you have any questions, just please let me know and give me a call. Thank you.